I am Dr. Anil Murarka. I am a senior consultant in plastic surgery in BLK Hospital.
Hello, I am Dr. Hina Kudyar. I am an associate consultant in the Department of Plastic Surgery, BLK Hospital.
I am Dr. Hitesh Anand. I am an associate consultant in the Department of Plastic Surgery, BLK Hospital. This was a 22-year-old boy for which we received a call in the emergency at around 2:30 in the night that the boy had met an accident while working in the night shift, and he was being referred here with an amputated part from a hospital in Noida.
See, in this, the patient comes with the amputation of the body part and usually the limbs. Okay, and in this case, the patient had amputation of his wrist of right hand. Okay, and they were referred to us from a hospital in Noida. So the part was well preserved. And we started the process immediately because this is a kind of emergency and we have to organize everything very fast and rejoin the hand, amputated hand, as soon as possible so that we can get a good result.
This is a very complicated surgery because it's a total amputation of the hand or the wrist or the particular part, and we need to rejoin all the parts starting from the bone to the tendons, to the nerves and vessel and skin also. So it takes a very long duration of time to reattach all these parts and to give it a blood supply, and it is a team effort also. We started, this patient came to us at around 3:30 and we started around 5:50. Because this patient came in shock, we had to stabilize it first because of the excessive blood loss. He was in condition of shock. He was not maintaining BP, he was hypotensive. So we had to first stabilize this patient, then as soon as we could take up in the OT, we started surgery.
And this requires a dedicated team of surgeons, and that includes plastic surgeon, microsurgeons, plus to fix the bone we need sometimes help of orthopedic surgeons also. So it has to be like a team effort so that we can fix the parts as soon as possible. And we in BLK have a very dedicated team of surgeons who are well experienced in doing this kind of surgery. See, microsurgery is one of the branch which is not available in every hospital, and that's a specialized branch of or sub branch of plastic surgery. And we in BLK have very experienced microsurgeons, and they can fix smaller vessels like 2mm vessels also. And we are doing these kind of surgeries very regularly, and we have very good microscopes here and very good like auxiliary services where if we need help of them.
I think part preservation is very important in this surgery. As sir has already told, replant is a very fine surgery. It requires micro anastomosis, vascular anastomosis, the tendons have to be rejoined. So the part which the patient comes with, brings with along with him, it has to be well preserved. The part, if possible, it has to be thoroughly washed. Then if there is availability, like this patient came from another hospital, so if there is availability of some sterile gauze pieces, the part can be first wrapped in sterile gauze and then placed in a polythene bag, and that bag has to be surrounded by crushed ice. The precaution which has to be taken is that that part should not come in direct contact with the ice. So I think part preservation is very important, which further helps us in doing this surgery. All the vessels, there will be constriction of the vessels, and we will not be able to rejoin them again.
Another thing is, if we are not keeping them in low temperature because of the heat and other things, especially if it is in the proximal area, suppose it happens in the forearm or the arm, there are a lot of muscles. If we are not keeping them in low temperature, the muscles get like necrosed or destroyed. So that is the reason we preserve the part. And if we are preserving the part, we can, if there is a slight delay in the transportation also, it can be replantable. But if it is not prepared properly or not preserved properly, we can't replant. It requires a lot of time. Okay, suppose the bony union will take around 6 to 8 weeks, maybe longer than that. Okay, yeah, and fixing the tendons and nerves is one part. Other part is extensive physiotherapy. If they don't do extensive physiotherapy, it won't move. Okay, the blood vessel starts flowing blood immediately, whereas the nerves will regenerate slowly. It grows about 1 millimeter per day. So the sensation will come later. I mean, it may depends on what is the level of amputation. Suppose it is at forearm level, and to grow from here to the tip of fingers, it will require months. Okay, so sensory recovery or the motor recovery takes longer time. And meanwhile, we have to keep the physiotherapy going so that they don't get stuck. This happens in the the age group where the patients are very active and the productive years of the life. And suppose a manual worker gets his hand amputated, he may be the sole bread earner of the family. So this is a very important surgery. If we can spread the awareness that the patient these are if the patient hand is amputated or the forearm is amputated, if we can make them aware that this the amputated part can be reunited, so that will be the message we'll be giving to them. Okay, and we can definitely do this surgery, and it's possible, very much possible.
To know more, subscribe to our YouTube channel.
BLK Super Speciality Hospital, a passion for healing.